So today we have Jim Bombaci from Nutmeg Consulting, and he will be facilitating today's training. Jim, are you ready to introduce yourself? There you are.
Sure.
You muted
Yeah.
yourself. Thank you so
Yep.
much.
You're welcome. Hi, everybody. As you said, this is Jim Bombaci, and actually, Hanid just said my last name very well. Appreciate that. A lot of times that gets butchered. With Nutmeg Consulting, we've done a lot of work side by side with Mark over the last few years. This is just another one of those opportunities for us to work with you all to go over a series that we have that discusses high impact assessments and essentially the data elements associated with those assessments that you're required to collect in HMIS as determined by HUD. These assessments and data elements have a very large ripple effect through the system, as you'll see as we go through how each of these high impact data collection points not only impact your agency reporting, but also your COC reporting, and then of course any other reporting that might go to a statewide report, and ultimately everything that goes to HUD through APRs, CAPERs, path reports to SAMHSA, and of course emergency shelter data through the CAPER as well, rapid rehousing, homeless prevention, all those program types. So as I go along, if you have any questions, if you could type them into the chat, then maybe Hanid or Sherry, you all can let me know if there's a question that comes up that would be something that we might want to discuss with the whole group, or if there are things you just want to answer on the fly, that's fine too. Okay, so here's the cliche image, the drop of water creating that ripple effect. If you think of that drop of water there as a data element, and the way it ripples through the system, that'll help with the visualization portion. And of course, the cliche comic, use the CRS database to size the market. That data is wrong. Then use the SIBS database. That data is also wrong. Can you average them? Sure, I can multiply them too. I'm sure as you can all appreciate this comic when it comes to pulling data out. The biggest issue that we all hear is the data going in is no good, the data coming out is no good. So again, that hopefully this review of the high impact assessments will help cement the real purpose behind these data elements, the reasons the questions are being asked, and what the ultimate use of those questions are. So as you can see, again, the data going in will result in either more housing opportunities or more funding for services for the homeless population in your particular COC. A little background, back in 2001, Congress asked HUD to take the lead in inquiring communities to develop an unduplicated count of the homeless. They required federally funded public and nonprofit organizations to implement some type of tracking system, which we all now know as HMIS, the Homeless Management Information System. The data is aggregated there to provide the information necessary to establish effective national policies to address homelessness. So essentially, the purpose here is to say that your data isn't going nowhere. It's used not only at the agency level, but also at the federal level to try to figure out where the best place would be to direct the funds. HMIS helps to gain a clear understanding of the prevalence of homelessness and to track the client service needs over time. And understanding these complexities can help for a more responsive system. So data that has helped determine need, so things like chronic homeless beds and programs. So that was one of the very first uses of the data when the McKinney-Vento Act was signed back in the 90s, it was 89, 90, to help address the growing homeless issue amongst those who were disabled with mental illness. And as state hospitals were closing, those who had no family or other place to go, a lot of them ended up on the street. And then they started to realize that these particular populations, though they may have only been about 10% of the overall homeless population, they were absorbing over 90% of the resources. And that's where the notion of chronicity came into play to try to figure out, okay, how do we identify this population so we can target this population? And that's where you get your chronic homeless evaluation and your chronic homeless definition. And then from there, over the years, things like rapid rehousing and homeless prevention came into play. Veteran programs started to evolve further than they were at the time. Youth programs have been the more recent targets, and runaway homeless youth, and family and individual specific programs, so helping to determine the need by using your housing inventory and the annual homeless count, along with the aggregate annual data that gets collected for system performance measure, LSA reporting, which we'll talk about those definitions in a few minutes, domestic violence programs, and then, of course, what kind of income, non-cash, and health insurance are needed to help support these populations. So all the data that has been collected, which used to be collected manually years ago, organizations that got funds from HUD or from state funds would submit progress reports, again, mostly handwritten or typed, self-reporting, very little technical involvement. A lot of the times, agencies were just giving their best guess. And that's when HUD decided, let's really try to be scientific about this. And that's where they provided funds for communities to purchase a homeless management information system so they could gather the data and then compile the data in one place and then get better research quality data. Report acronyms, as we talked about just a second ago. PIT, point in time count, most of you are familiar with that. The APR, annual progress report, probably too familiar with that one. SPM, system performance measures, and LSA, longitudinal system analysis. This used to be called AHAR, annual homeless assessment report, which is a very nice name, nice acronym. Now being called LSA, longitudinal system analysis, is not as friendly or fun to say. These two, system performance measure and LSA, longitudinal system analysis, many of you probably really don't have a lot to do with, other than getting an email possibly from people at MARC or your COC saying, hey, we need you to fix this data so we can improve our SPM data or LSA data. But otherwise, on a regular routine basis, you're really not directly dealing with these two reports, but the data you're putting into the system is impacting these two reports the same way it impacts your APR. And that's really what we're going to talk about today, is how the data cascades through the system to impact these categories above and beyond your agency use, but all the way up to the federal submission. So here's your sort of Venn diagram of these reports. So your APR is the hub. The APR is the report you all have the access to and the most control over. It's the one where you see something wrong with your data, you go in and change it and rerun your report, you've impacted your APR. But what's also happening at the same time you're editing and modifying and fixing your APR, you're also impacting these other three annual events, the SPM, LSA, and PIT, all annual submissions. SPM and LSA are looking at very closely at data as it relates to the individual clients and how that data is impacting specific categories. We're going to talk about those categories as we move through. PIT is more along the lines of making sure that you have entries and exits done, housing move-in dates done, and you have an accurate count of the number of beds that you have available for your overall population of people. So this is where the number of people you serve and your entries and exits, that's where they will impact the PIT process, making sure that if you are funded for 10 beds, that over the course of the year, you've served at least 10 households, whether that's individuals with children or individuals without children. And then SPM, as you can see, I have the definitions there for you as well. SPM is, as a system performance measures tool, is looking at just that. It's looking at performance, how long people stay homeless, do they return to homelessness, how well are they doing with income and non-cash and health insurance and things like that. And LSA is a little bit more overall review of are your projects functioning the way they're supposed to be functioning? Again, as far as if the program is designed to serve families, is your inventory reflecting that? And then it does have some overlap with SPM and APR on data quality points that it looks at, but LSA really also pulls in housing inventory, which again ties back to the annual PIT process. So again, a very tangled web of reporting and monitoring that's going on that all starts at your keyboard as the case manager, the data entry person. You are in 100% control of how the results pan out based on your understanding and knowledge of the assessment questions, and then how to actually ask those questions of the individual who you may be interviewing at the time face to face, or a document you may be just given by another case manager who actually sat down with the client. So we're going to talk about that dynamic as well. High impact assessments, the list of them here that we're going to go through: approximate date homelessness started, enrollment start date versus housing move-in date, prior living situation, homeless history, disabling condition data, not income, non-cash, and health insurance data, exit destination, and returns to homeless. These are the categories we're going to go through. And certainly, as I said, if you have any questions as I go along, feel free to type them in the chat, and Hanny or Sherry will stop me if it's something that looks like might need further conversation. Okay, so first we're going to talk about high impact assessments. Approximate date homelessness started. Many of you are familiar with this question. This is the question that when you identify a location that is a homeless location of where the person came from, you get this date field that pops up. So if you say the person has a place not meant for habitation, you're going to have to provide a date when they started in that location. Or if you say emergency shelter, for example, or safe haven, again, same thing, you're going to see this field pop up. The purpose of approximate date homelessness started is to find out from the household or the individual that's being interviewed, when did your homeless episode start prior to this enrollment? And a lot of times this question is misinterpreted, and it has a very large impact across the overall data system when it comes to determining how long households are homeless from the date that they start getting served. And we're going to talk about that. And you can see how this assessment question ends up on your APR Q22E, length of time homeless prior to housing. It makes its way to this table, so it gets reported to HUD at the agency level. But then it also makes its way to the system performance measures table that looks at length of time homeless, and also the detailed data for that. And then finally, the LSA table, there's a length of time homeless evaluation. So you can see this one question hits 3 reports: APR, system performance measure, LSA. This is just the detailed data from the LSA. So it tells whoever runs the system performance measure for your community, it tells them which enrollment is having the largest impact on the number of days somebody looks homeless in the system. And that's through the days homeless column. Okay. So this is a graphical representation of where the data goes from the time it's entered until the time it gets to the report. Okay, so approximate date homelessness started. I actually updated this. So Hanid, if you did send out the PowerPoint, I'll send out this updated one with the location on the 2022 data standards. It's actually page 102 of that data standard, and bullet number 3 gives you the detail you need. So this assessment is intended to reflect the date from household's last living situation immediately prior to project start. Have the household look back to the date the last time they had a place to sleep that was not the streets or emergency shelter or safe haven. The look back time would not be broken by a stay of less than 7 days. So if they stayed somewhere 7 days or more, that would break that period. If it was 7 days or less, then it would not. And then also if it wouldn't be broken by an institutional stay of less than 90 days. So if they were homeless prior to jail, hospitalization, or substance abuse treatment, then if they were in there less than 90 days, then they could count that as as still being homeless during that period of time. So the key here being, when you sit down with the client and you ask them, what was your prior living situation immediately before coming to us? So if you're in an emergency shelter, and they say, well, just prior I was staying with friends and family, or if they say just prior I was living in my car or an abandoned building, those would obviously be the responses that you would provide. If you're a rapid rehousing program, PSH program, same rules apply. If they say, well, I was staying at an emergency shelter, then you stay at the shelter. Or if they say they were staying with friends or family or on the street. Where people get caught up with this is they ask the client, tell me the last time you had a place to stay that wasn't the street. The person thinks back, well, geez, my first time homeless was in 2010. And a lot of times that ends up being the date that gets entered. So the person is enrolling your program on January 18th, 2022, and they told you that their homelessness started on January 1st, 2010. You put that date in. Now that person has a homeless history of not having been housed for 10 years. That may be true, but it also may not be true. So make sure if they give you a very long homeless start date, that you say, okay, so just before coming here, where were you? And if they say the street, say, okay, so the last time you stayed in a bed somewhere, and the person said, oh, well, I stayed with family for about a month or 2 months, back in December. Okay, well, that would be a break in their homeless history. So you would then have to go back to look at, okay, where were you just prior to this episode of homelessness, or where were you just prior to coming to this program? Because again, if they stayed with friends and family 30 days ago, well, then they haven't been consistently homeless for the last 10 years. So again, be very careful how you ask that question and make sure you understand the nature of this question. You'll have the PowerPoint slide to go back to, and you also have the data standard, which gives you an example of how to ask that question. The APR, question 22E, the table on the APR, will show you the breakdown of number of days homeless based on that homeless start date, if the client has any homeless start date data in your program. So for example, if you're a rapid rehousing program, permanent supportive housing program, or an ES program, you can use the CAPER to find this table. And that'll give you an idea of a ballpark of how accurate your data is. So you can look at this table and you can see how many clients you have where they said they were homeless for anywhere from 366 to 730 days prior to your program. You may want to look at those and verify them. The same as 731 days of homelessness prior to entry, you might want to verify that as well. And I'll show you that your APR detail will have that data for you. So again, SPM evaluation of date homelessness started to when they are housed. The approximate date homelessness started provided at the emergency shelter or transitional housing level. This will be used to compare against the date from entering into permanent housing. So for example, if the client was in an emergency shelter environment, they had a homeless start date of 1/1, let's say 2021, and then they enrolled in a permanent housing setting with a housing move-in date, not program enrollment start date, but housing move-in date of 1/1/2022. Well, now you have a client whose total number of housing or homeless days would be 365 days. So that's how the report looks at it. It looks at the approximate date homelessness started that was entered into an emergency shelter program, transitional housing program, and then the system keeps counting the number of days that person was homeless from that approximate homeless start date all the way up until they have a housing move-in date. So understanding the guidance for this question will help ensure that you have an accurate start date for when homelessness happened. So it's being compared to the accurately compared to the housing move-in date when that occurs. So in the sample below, this is actually the actual SPM table, not from your particular community, but the SPM table metric 1B of how it looks at the housing move-in date and approximate homeless start date to calculate the number of days, the average number of days homeless. So in the sample below, there are a large number of homeless start dates that go back over 10 years. That's what's creating this large average number of days homeless. 510 is a long time in HUD's calculation for somebody to maintain being homeless. So the users recorded a start date that reflected the first time the household could recall experiencing homelessness versus when their homelessness actually started prior to that particular enrollment start date. So this will result in that large average length of time homeless that may be inflated. So 489, 510 days on the metric 1B table. This would be something your community, when they look at SPM, would trigger them to go look at the detail, to go look at the actual client record that were contributing to these large averages. And in many cases, it's because the approximate date homelessness started was an inflated date. It wasn't the actual date the homelessness started from that event, that homeless event, but something that the user entered that the client said, my homelessness, well, it all started back in 2002, 2008, something very far into the past. So again, be careful when you're asking that question, and then make sure if it is a date that goes very far back in the past that you evaluate that question and really get down to when did their homelessness start prior to coming to your program. Okay. So again, Metric 1B detail report is here. So that's what feeds this number, is your community sees this detail. And you can see in the days homeless column, you have 137, 6 days, 137, so on and so forth. And this report you can filter to see the larger numbers. And there'll be cases where you have clients with over 1,000 days homeless or 5,000 days homeless. And again, those are the numbers that are contributing to those large average length of time homeless. The LSA report that we talked about, this also looks at the length of time homeless. As with the SPM and APR, it will evaluate the time homeless by using that approximate date homelessness started. And I got a typo there. I'll fix that after. After the approximate days homelessness started, so it'll look at the average length of time the households were an emergency shelter, safe haven, transitional, so on and so forth. And again, the communities, when they see these data elements, they can go and look and they see the high percentages, and they can isolate and figure out which client records are contributing. Okay. Before we move on from approximate date homelessness started, were there any questions that came up that we should discuss, or are we okay to move on? I'll guess with silence
Jim,
that we're. Yep.
I was actually in the middle of typing. This is Christina over at Catholic Charities.
Yeah.
So I just want to verify. So let's say the person has been off and on homeless the last 5 years.
Mm-hmm.
We want to capture their most recent time that they were considered homeless based on the definition, correct?
Correct.
Okay.
Yep. So let me go right here, because that's a great question. So in HMIS,
can I ask a question about that?
Yep.
If that's the case, then how do we capture the chronic homelessness that is occurring in this particular subject?
So yeah, again, so if, let's say, the person's place not meant for habitation was their answer, length of stay in that prior living situation. So if they were homeless for a year, so for example, this particular record, the person's homelessness started in 2011, and they were there for a year or more, that's where you get into the more detailed question. Was this more than 12 months? Was it 4 more times? So you're going to have circumstances where it is true a person was homeless for a year or more prior to coming to your particular program. If you're emergency shelter, again, that's what HUD is looking for. They're looking for those people who were truly homeless for 12 months or more, or those 4 episodes in 3 years. And that's what the data in HMIS will allow you to aggregate. They don't want, that's why they want you to look at those breaks in homelessness, because if a person prior to coming to your emergency shelter, if they were staying with friends and family for 10 days, 15 days, 30 days, then you're going to say they were with friends and family. But if they say, well, I was with friends and family, and you say, well, how long were you there? And they say, I was only there for a night. Well, then you say, okay, well, where were you before you stayed with friends and family? I was in my car. Okay, how long were you in your car? Well, I was in my car for 30 days. Okay, where were you before your car? I stayed with friends and family for a night or two. Again, those aren't breaks in homelessness, so you can get back to that original date. But they want you to be a little bit more cognizant of, when, approximate date your homeless episode prior to enrollment started, not the homelessness start date from when you first became homeless. So again, you'll work into that number, because if the person has truly been homeless for a year or more, you'll find that out by talking to them. Like I said, in this example here, this person, their actual homelessness start date was in 2011, based on the data collected and discussed with the individual when their enrollment happened back in 2015. This is a PSH example. So PSH programs, you're going to have clients where you have a long-standing PSH program that they very easily could have had that long homeless history. And then again, emergency shelter, same thing. When you talk to them, where were you, again, as I said, before you came into this enrollment? And They say, well, I was living on the street. Okay, how long were you living on the street? Well, I've been on the street for 6 months. I've been on the street for a year. And then just ask them, during that 1 year of homelessness, did you stay with friends or family ever? Were you ever in treatment? And if they say no, well, there you go. You have your 1 year start date for their homelessness. So keep in mind that 7-day break period. If they, again, didn't stay anywhere less than for more than 7 days, that's not a break in homelessness. If they were in treatment for less than 90 days and homeless prior, that's not a break in homelessness. So again, they're still working towards that chronic number. It's only if prior to coming into your program, they were in treatment for longer than 90 days or stayed in a more permanent setting for longer than 7 days, those would be where you could have a break in homelessness that you would want to keep track of. Good questions, both of those, because they are complex data points.
So you're saying before coming into our program, but so if someone is staying, you know, at a shelter or something like that, and like that's maybe where we're doing the like a VAT or something like that, that would still count as homeless. We're not even,
Yes.
you know, okay.
Yeah. So the other thing you can do is most clients now have long histories in your in your HMIS. So for example, you know, if I look at this particular client, they're in a PSH program that started in 2015. But if I look through their homeless history, I can see they were in shelter in 2014. And they had no break in homelessness that I can see from 2014 all the way to 2015. And if I go back even here, I see they have a homeless history that started in 2011 based on their emergency shelter activity. So you can be pretty confident if you look back at old enrollments, if you're trying to ascertain that actual homeless start date, you can see the history. So if the client gives you a date that makes sense to their history in the database, then it's probably a good date. And you can even go back and look at the enrollments to see when they told the last place they went to, you know, where their homelessness started. Because that's the other value of having an open system is you can check your work essentially. You know, you can check to see what did they say at their emergency shelter stay. If I can grab one of their emergency shelter stays here. Now, when you go back in time, a lot of times this data might not be gettable because the question didn't exist yet. But you know this person was in an emergency shelter on 3/29/2011. So you know at the very least their homeless episode could be as old as 3/29/2011. And so again, that's where part of that conversation would come in prior to enrolling in our PSH program or ES program. Where were you? Where were you sleeping? Where did you sleep last night? I slept in my car. How long have you been in your car? I've been in my car for 10 years. Okay. In 10 years, did you ever go into treatment? Did you ever stay with friends or family or get a Section 8? Things like that. Because that will help you, you know, sweep to that closer number, to whittle down to that closer number of the actual homeless start date. Any other questions about that one? Okay. All right. So now enrollment start date versus housing move-in date. It's very important to understand the distinction with these two data points because one is just an enrollment into a program. The other actually stops the homeless clock from counting. So enrollment start date is the date the person started in your program, started services in your program. It's not necessarily, but could be the date they moved into the program as well. So enrollment start and housing move-in date, they have again, their own ripple effect through the system. Housing move-in date will also land on the APR question 22C, table 22C. It also influences metric 1A, housing move-in date influences metric 1A and 1B for that matter on SPM. And it also impacts LSA to look at the move-in date values for everybody in the projects. Enrollment start date versus housing move-in date, length of time between the person's project start date and housing move-in date. That's just how the APR and other reports look at it. At the PH, permanent housing or rapid rehousing level, so permanent supportive housing, permanent housing, rapid rehousing, enrollment start date does not have much impact on the days homeless calculation for your program and for SPM reporting. Enrollment start date is just the day you're telling the system you started working with that person or household or family. It does not mean the day that that person moved into your program. Housing move-in date is the trigger that will stop the counter for determining how long somebody remains homeless. So this is where there's two clocks that are ticking here. There's the clock that looks at approximate date homelessness started to move-in date. Then there's the one that looks at enrollment in a homeless setting, enrollment in emergency shelter, enrollment in street outreach, enrollment in transitional housing or safe haven. So it'll look at the enrollment start date there versus move-in date. Then it also looks at the approximate date homelessness started to housing move-in date. It's often overlooked once the user enrolls the household into their HMIS program, but it's vital that people remember to go back and fill in that move-in date if it's not equal to the program enrollment start date. The APR has tables that will help you monitor the value. Table Q22C, as we talked about, showed that image of. And that can be used to assess how many households have a move-in date and how many do not. If an agency is able to maintain this data element, it will help provide the most accurate information for tables 1A and 1B for SPM, because they really look at housing move-in date to stop the clock, to say, okay, the average length of time a household remains homeless in this community is from this date to this date because there's a move-in date. If there's no move-in date, the clock just keeps counting and that particular household remains to appear homeless, even though they may be enrolled in PSH or rapid rehousing. But if there's no move-in date, the system does not stop counting them as homeless. APR table Q22C, that provides that breakdown. It will also show the number of records without move-in date. You can use your APR detail to isolate client records. SPM also helps to isolate those client records because essentially, if you have somebody with a large number of days homeless, it's very possible that they're just missing a move-in date. And this is a snip of the APR headings. And I'm going to talk about this in a second up above here. But these are the towards the end of your APR detail export. There's date started on street, move-in date, length to move-in date between the enrollment begin date to move-in date. And then there's a column for date started on streets to move-in date. It's only the head of household record, so you're going to see a lot of blanks, but you're only focusing on the head of household. And the other key is that the move-in date field is dependent upon the program, when the person enrolled in the program. So if you're a PSH project, you're going to want to run your report for a very large date range to make sure you capture as many people as possible if you've never monitored this date in the past. If you've monitored this date, then you could probably run a 2-year APR because most likely you've captured everybody prior to that. But if you've never really monitored that date, run a very old APR from 10/1/2015 forward. And that'll show you if you have anybody missing that date. And the reason why 10/1/2015 is the magic date is because that's when the approximate homeless date field started being measured. And HMIS vendors across the country, all the HMIS vendors for all the communities that use HMIS, the rule provided by HUD was any enrollment that started prior to 10/1/15, the HMIS vendors added the program enrollment start date as the move-in date, just as a, starting with a clean slate. Any enrollment that started after 10/1/2015 was the responsibility of the agency to make sure they updated after the 2015 data standards. For rapid rehousing programs, those are, in theory, and per HUD guidance, those are 12-month projects. So you'll want to run, if you've really never evaluated this field before, run a 2-year APR on your rapid rehousing program, and you can take a look at that date field. But if you've monitored that, then you could run a 12-month APR if you wanted. But the key is just get into the habit of taking a look, making sure that for your grant year, especially, so if your grant year is January 1 to 12/31, when you run that, take a look at your APR detail to make sure that everybody whose enrollment started in that grant year has a housing move-in date for the head of household record only. Move-in date is further evaluated in SPM and LSA, as we talked about on SPM. Metric 1A specifically is the trigger to stop the count. And I just want you to take note of the difference in the number of days for the average length of time homeless in metric 1A versus that metric 1B table that we looked at earlier, which was 400 or 500 days. So you can see the impact of approximate date homelessness started on average length of time homeless versus when the system is just looking at the enrollment start date versus length of time homeless. Again, that approximate date homelessness started can really inflate the community numbers of how long somebody looks to be homeless in the system. So again, that's why it's important to have an accurate number there, and equally for metric 1A, which is looking at the enrollment start versus move-in date, having that move-in date entered into the client record is going to help maintain that value. HUD looks for, on metric 1A, they're looking for 45 days or less for average length of time homeless. Now, realistic or not, that's the number they're wanting communities to shoot for. And then it also, the LSA report looks at this value as well. Okay, so before I move on to the next assessment, any questions on enrollment start versus move-in date? I'm sure everybody's familiar with it, but let me just get to where housing move-in date exists. Just so you may notice that my layout of HMIS is slightly different than yours. I'm using our support system. I was just running into some slowness with Kansas City's when I was pulling up enrollments and assessments and things. So just for the sake of time, I'll use ours as a sample. The location of things is the same. So again, housing move-in date, here's an enrollment that started July 1, 2015, and housing move-in date for that particular one you can see is July 1, 2015, because this was before that data standard. So the vendors backfilled these data, these fields with the enrollment start date. Had this enrollment been a more recent enrollment, then you would put what the actual move-in date would have been for that particular household. Okay. The prior living situation. So we're going to talk about this one. This one has a few different ways that it impacts not only your individual agency's program, but also, again, across the system of reports that we have for HUD. The type of residence ends up on your Q15 APR table. It also plays into metric 1A, and it also plays into the LSA. So if you say, or if your client's prior living situation is a homeless setting, the data for that client gets added to the universe of data that's going to be evaluated in LSA and SPM. It's also important to note, if you are a rapid rehousing program, for example, where everybody from your program is supposed to come from a homeless setting, then prior residence is an important data point to keep an eye on. Same thing for if you're a PSH program where you're supposed to serve either 100% chronically homeless or a certain percentage of chronically homeless. You want to make sure that your prior living situation is showing that you have X number of people coming from a homeless setting, because again, you want to be abiding by your HUD contracts. It's a meaningful assessment question as well for a few project types. At the emergency shelter and street outreach level, this question actually might be a catalyst for an aggressive intervention. What we talk about here with this one, so if you're an emergency shelter provider or street outreach staff person and you're engaging a client and you ask the client, well, what was your prior living situation? And they say, well, I was living in an apartment with a Section 8 voucher, or I was living in an apartment that was subsidized for people who were, who had prior homeless history. And they just vacated that unit. Often individuals, especially individuals dealing with substance abuse and mental illness, will leave an apartment because they think they've broken the rules and they're going to be evicted anyway, so they just don't go back. They may have gotten arrested, they may have gone into treatment, or they may have had an altercation with another resident in the apartment building, and to avoid the conflict, they just don't go back. So if you're an emergency shelter person or street outreach person, and a client has told you they vacated or left a unit that was a subsidized unit through, again, Section 8, VASH, rapid rehousing, permanent supportive housing, any of these type of scenarios, you're going to want to try to get that person reconnected to that environment as quickly as possible, because they may still have access to the unit or at least to that voucher, especially if the voucher follows the client versus a voucher assigned or attached to a unit. Often when we evaluate data with emergency shelters and street outreach programs, we'll see a small percentage of clients will have this scenario where they claim their prior residence was one of these locales, and after talking to them, find out the reasons that they left weren't actual reasons where they would have lost the apartment. So just something to keep in mind when you're interviewing an individual and they provide that as a prior residence. So this slide goes into the details there of the different types of locations. The APR will aggregate your responses of prior living situation on, as I said, table 15 on the APR. That's more for you as PSH, rapid housing programs, especially, to go and take a look and make sure that you're meeting your minimum requirements. If you're rapid rehousing, make sure that everybody in rapid rehousing had a prior residence of a homeless setting. If you're a PSH program that has chronic homeless responsibilities, make sure you're meeting that minimum percentage by showing that the people are coming from a homeless setting. The prior living situation for metric 1A is influenced by living situation response. It's important to obviously collect the accurate information here of where the household was the night prior. We've talked about this quite a bit during this presentation, because it does determine what data gets pulled into metric 1A based on the prior living situation. And same thing with the LSA. LSA treats it similar to how your APR treats it. It's going to give a breakdown of locations. The big thing that they're looking for is a minimal number of records that have refused, don't know, or unknown assigned to them. Metric 1A will track the length of time homeless based on the enrollment start date for households who are enrolled in emergency shelter or street outreach. It will also include a household if they have an enrollment in TH or PH where their living situation the night prior was homeless. It will include households if they have an enrollment in TH or PH program where the living situation the night prior was an institutional setting where they stayed 90 days or less. So again, important to keep those in mind. And last but not least, that 7 nights or less in a housed setting will also trigger them to be pulled into metric 1A. So again, this slide in particular is probably going to be a helpful one for keeping the rules in mind as to the type of response and how that response makes its way rippling through the system based on what the individual says when you're interviewing them. And okay, so now homeless history. And again, this question was brought up a little bit earlier, okay, how do we make sure that if the person is chronically homeless, that we're actually capturing that? And that's where we get into that homeless history and chronic homeless evaluation to make sure that everybody is collecting the data on those chronic homeless households in a manner that will accurately reflect whether or not they truly are chronically homeless. So homeless history is made up of those several assessment questions that are associated with prior living, and it's used to calculate the chronic status. So number one, obviously they have to be disabled. So it's important after that to make sure that you're capturing the fields as accurately as possible and limiting the number of don't knows or unknowns for these fields, because these selections, as they relate to homeless environment, they are required fields. But if you don't have substantive data, then the system can't accurately calculate whether or not the household was chronic. And HUD also wants accurate chronic homeless counts. And again, that's why we get into that conversation of it's important to understand the episode prior to admission and work backwards from there. So where were you the night prior? I was in my car. How long were you in your car? Well, I've been in my car for 10 years. Okay. You say you've been in your car for 10 years. Any time during that 10-year period, did you stay with friends or family? Were you in treatment? Were you incarcerated? How long for these particular environments? Because that will help get you the most accurate number of chronically homeless individuals or households that are out there by working through those questions with the individual. As with emergency shelter and street outreach enrollment, approximate date homeless started will continue to be vital, as we've talked about. PSH and RH users should pay attention to what the household reported in their previous enrollment. This is key because, again, having an open system, and I've seen this in many communities when we look at SPM data and LSA data with those communities. You look at it enrollment, the person says in their emergency shelter enrollment, I've been homeless since 2011. But then you look at their HMIS data and you see that they had a PSH enrollment in 2015. So, okay, that emergency shelter enrollment that started, on a particular date where they said they were homeless since 2011, but they had a housing episode for, 12 months in 2015. Well, then they truly weren't homeless for the last 10 years or 11 years. They really were only homeless for about 6 years, maybe, or less. Again, important to use the system to help answer those questions whenever possible, especially if the client gives you a very large date range. Take a look and see if the system has anything that might contradict that, and then try to work closer to the real number of how many days the person was homeless based on when their true homeless episode started. For programs with specific funding sources, again, keep in mind those households that have to be homeless prior to entry for your particular project, or the number of chronically homeless households you're contracted to serve. Monitor the prior living situation table, as we talked about, because that'll help you keep an eye on that. And that's on the APR table. All right. Before we move along, any questions about those categories?
Hey, Jim, we do have a follow-up question in the chat about, I want to say, HMIS's ability to capture different instances that the client has had experienced homelessness in the last 20 years.
Mm-hmm.
Let me read back. And Jeff, I think you're also with us here.
Yes.
Okay, hey, Jeff.
So I asked the question earlier about how chronic homelessness. So even if the person has been housed for small periods over seven days in the course of, say, 20 years of homelessness, how does the system really capture the fact that the person has been homeless for 20 years, even if they've had little breaks here and there? Mm-hmm. I think that's a critical piece for what I'm looking at anyway.
Yeah, right. So in this particular example, do you have a client in mind where you have this scenario?
No, I do not. Not at the moment. Okay. We're not currently actively using the system. We're coming on board right now.
Yeah. So a good example or a good sample of this would be this particular client that we're looking at here. Their homelessness started, their emergency shelter, their first emergency sheltered episode started 10 years ago, mm-hmm. or almost 11 years ago. It started in March of 2011. So their emergency shelter enrollment has an assessment in the system that you can actually check to see when that 2011 emergency shelter episode. Again, that question didn't exist in 2011. So you know at the very least, this person had an emergency shelter enrollment that started in 2011. So then you can talk to the person about, okay, prior to 2011, where did you stay? And they can give you some information about that. So maybe their homelessness prior to this episode started in 2010. And then as you work with them and say, okay, so since 2010 until this emergency shelter episode here in 2014, did you have anywhere to stay? Did you stay anywhere for more than 7 days? And they say, well, yeah, I stayed in 2015, I stayed with family for 6 months. Mm-hmm. All right. So it doesn't negate that they were homeless from 2011 to 2014. It's just that date is not now part of your current enrollment because they had that break. But it's still going to show that the person, when you break this down, the person's going to meet the chronic homeless standard, because they're looking at chronic homeless is 12 months or the 4 more episodes.
Right.
So this person is going to have that episodic homelessness because in 6 years, 5 years, they only stayed somewhere for 6 months. All right, well,
Okay.
you're gonna show that over time this person had many episodes of homelessness that's going to equate to chronic homeless.
Right. So
Yeah.
one last question, just to clarify where I'm coming from.
Mhm.
If the person's never been in the system, but they're reporting this history now,
Yep.
are the questions going to allow me to record that history, or do I only record the history for this latest episode? And then we have to kind of move forward from there.
Yeah. Yeah. So if the person, let's say, has never been in HMIS,
Right.
and their homeless episode, their very first ever homeless episode started in 2000.
Yes.
And then from 2000 to whenever they had a break in homelessness. Okay, well, now you're going to start from there and say, okay, so from there, how long were you homeless? And they say, well, from 2015 to 2020, I only had, I was homeless. I stayed with family for a year. Okay, well, then work from that year that they were with family and figure out their homelessness.
Mhm.
Because again, the best you can do is if you're working with them today
Mhm.
and their last episode of consistent housing was in 2015, well, that's the date that you're working from. And if they had nothing from 2015 until the day you're sitting down talking to them, well, then they're homeless. Their most recent homeless episode started January 1, 2015, and it still
Okay.
continues with you today, at your emergency shelter or your
Okay.
street outreach program. Yeah.
Thank you.
Yeah, and it is, and I'm there with you because again, I did prior to working with Nutmeg. This is my 20th year in the, I guess, in the profession. It was 11 years with PSH programs, and when the whole chronic homeless thing started, and they really wanted to focus on, okay, when did this episode start? And it's never sat well with any of us to say, well, we know the person has homeless history that started in 1999. It's not that you're throwing that data away per se, because you're still capturing the person as chronically homeless. Because again, if they've been homeless that long, they're going to have that chronic homeless history. And again, I kind of understand this notion of it. It is uncomfortable to not just say we know this person has been homeless for the last 20 years. But what HUD is looking for this question is most recent length of time homeless. Not discounting the fact that this person has had a long history, but the data that is pertinent to what they want to know about is how long has this person remained homeless from their most recent episode start date.
Yep.
Yeah.
No, I
So again,
understand.
I don't
Thank
want
you.
to belabor it, but I also want to put everybody's mind at ease because I'm there with you on the discomfort of not saying, well, we know this person has 20 years of it. But again, for the sake of what they're measuring, I guess, that would suffice. The most recent would suffice. But again, very important conversation to have at your agency. Very important to kind of conversation to have with the COCs, especially understanding the nature behind the question and what HUD is trying to capture for the data as it exists in the system today. All right. Disabling conditions. Most of you are well versed with disabling conditions and the fun that disabling condition data collection brings. It's obviously vital for the assessing chronic homelessness because rule number one, they have to be yes to disabling condition and then meet the homeless history standards. And they also have to be yes to at least one of the disabling condition types. And we're going to talk about that in detail. And the APR disabling condition tables will help you evaluate to make sure you're capturing all that information. And also disabling condition makes its way to LSA. It's important to ensure not only that the household is accessing the proper services, obviously, but to establish chronic homeless status, as we talked about. In order for them to be chronic homeless, the head of household, at the very least, in a chronic homeless household has to have a disabling condition. Successfully collecting this data will go a long way for the homeless history and to identify households as chronically homeless on the APR and LSA reports. It's vital to ensure access to the widest range of housing opportunities as well. Disabling condition is miscalculated in HMIS due to user error at times. User will choose no for the disabled question, but then choose yes for one or more conditions. And what we mean with that is in your HUD assessments, HUD Universal Assessment at entry, sometimes the user will say no to this question. But then in the HUD assessment, the HUD program assessment, when they get there, they'll identify as soon as it opens. Support site moves a little slower than live. So they'll identify one or more of the disabling condition values as yes. So I'll just go back to my screenshot instead of waiting for that. So here. So you said the user said no to disabled and HUD universal, but said yes to one or more of the disabling conditions. That's going to create that data incongruence. And it's important to note that if a person is disabled, their disabling condition on the HUD program assessment table, if they had a disabling condition of yes there, then it should be, oh, it's my test household, might be causing a problem. If they're yes on your HUD program table, then they're going to be yes on your universal, and vice versa. If you said yes on the universal data collection that the person is disabled, one of these has to be disabled. The key here being that expected to be of long duration question. I think did I grab a larger? No, I didn't. The expected to be of long duration question. If you're saying that the person has a mental health condition equals yes, and it's impairing their ability to live independently, then that next question is also going to be yes. And why that's important is sometimes users will say yes to mental health disorder, but they'll say no to impairing their ability to live independently. And they're enrolling that person in a PSH program where the person's rent is subsidized and they're receiving services. If the person's condition was such that it wasn't impairing their ability to live independently, then they would be able to access a fair market rent situation and have gainful employment. So if they're on disability, for example, they're on SSI, they're on SSD, and they're enrolled in your PSH program for people who need rental subsidy and support, then that question is going to be yes. The response to that's going to be yes. So you want to make sure your data is congruent when it talks about disabling condition. The disabling conditions table on the APRs, we said, will provide you the number of yeses, the number of nos, the number of data not collected. So just make sure you pay attention to that. It's important for the user to understand HUD's intent for each condition question. So we talked about that. Is the person's yes to disabling condition, then is it of long duration? For mental health, substance abuse, things like that, most likely it is impairing their ability to live independently. Otherwise, they would be in a fair market scenario, fair market rent scenario. There's also the disabling condition. I'm going to provide this document as well. What they identify as chronic conditions, because often the chronic condition is selected inappropriately, chronic health condition. I'll have that breakdown for everybody so that can be sent out. Just because somebody is yes to HIV, that does not mean that they're yes to chronic. That's, again, not HUD's list of intended reasons for chronic health condition. Also, developmental disability. For somebody to be yes for developmental disability, they had to have been diagnosed prior to the age of 21. In some states, it's prior to the age of 18. So just make sure you understand those rules before saying yes to the developmental disabling condition. But I'll provide that document so that can be sent. Keep in mind if the project is designed to house those who are disabled, so you don't want to say no to the disabling condition questions or no to the yes, no to disabled question, because then you might be going against your funding. Also, the types of condition are very specific. So as I talked about chronic health condition in those categories, I'll provide that breakdown. So make sure you have that handy until you or users feel comfortable with it. And so, as I said, I'll provide that list. Then the LSA for disabling condition, obviously that plays into the chronic homeless calculation, so that will throw off the chronic homeless counts. So make sure that if people are disabled that you're identifying that, because they can't be calculated to being chronically homeless if you don't have yes to disabling condition and to being disabled. Any questions on disabling condition? And people are pretty well versed with that one. So, okay, income and non-cash and health insurance. These are pretty straightforward. I won't go too crazy with them, but just understand the ripple effect that they have. HUD measures your APR progress, and that's somewhat redundant because APR is progress report, but they monitor the interventions that your agency is providing, and they use income, non-cash, and health insurance as one of those metrics. So if people are improving income over time, if people are gaining access to non-cash categories or health insurance categories over time, that's obviously looked at favorably by HUD. It's also calculated for the COC funded projects on your SPM report. So it's really important that you do those annual assessments. And it's important that you update those records at minimum annually. Income, non-cash, health insurance, obviously those are the three major ones. For PSH and RH, these three categories are expected to be areas of maintenance and or improvement. So essentially what that means is the numbers stay the same or improve, they don't go down. Obviously in the various scenarios we're dealing with right now, especially with the population that we all work with, you are going to have clients who they're going to be susceptible to have a job that may go offline because of COVID, more so than people in other environments where they can work from home. So clients of yours who work in retail scenarios, they work at grocery stores, they work at various locations where they have to physically be present, and that particular location cuts down the number of staff that come to that location. That may impact your clients. So again, HUD is sympathetic to that. They understand that, and I think they're going to be lenient with how they evaluate these data elements over the last few years. So just keep in mind the goal is to try to maintain whenever possible and help the individual improve their financial situation, non-cash benefit situation, or their insurance situation over the amount of time that they're with your project. The other big one that comes up a lot about this category when it comes to the APR is that the data is assessed annually based on your grant start and end date. So often people will say, well, my client, they had an income change, but it happened after my report end date. So I run my report from May 1 to April 30th, and my client had an income improvement May of 2021, but that doesn't influence my most recently submitted report. So it looks like this person didn't have an improvement in income. Well, it will on your next APR. It just won't impact your current APR, and that's okay. On your next APR, you're going to show that improvement because you're going to show that even though the person's income improvement didn't happen last fiscal year, it happened this fiscal year. So you'll be able to show that improved scenario. And again, remember, you only have to do it once a year. So if something changed after that, you can show that they had that improvement. At least they had that one instance of improvement on their anniversary date. And then the following year, if they are still in that negative scenario. So for example, let's say on their anniversary date, when you did their annual assessment, they had an income improvement, and then 6 weeks later they lost it. Well, HUD only says they want to know what happened on that anniversary date, within that 30-day window before or after their anniversary date. So that's the data you're providing. And if something happens sometime after that, that'll be captured on the next APR, should they still be in that situation at their next anniversary. So again, keep that in mind, that it is based off the client's anniversary, their annual assessment, and your APR submission off your grant dates. So there will be times when you have favorable data. There will be times when you'll have to show that the clients had a backslide for one reason or another. Exit destination. All right, so we're getting into the whole home stretch here between exit destination and returns to shelter. Exit destination is obviously important for a lot of reasons. It impacts your APR, and it is a performance measure, so system performance measures and destinations on LSAs. Where people end up after leaving your project is a very useful measure, and it's a very easy one to keep track of. If you're a rapid rehousing or PSH program, are they exiting to a equal to or better scenario? If they're emergency shelter enrollments, are they exiting to housing? If they're street outreach, are they going from maybe a sheltered situation to a house situation? The obvious thing to avoid is scenarios where the person goes from a housing environment to a sheltered environment or a homeless environment. So at the emergency shelter and street outreach level, gathering the exit data is a challenge, and HUD understands that. So this particular slide talks about that a little bit. So one thing to think about as a community, for example, Connecticut implemented a question for data collection at entry for emergency shelters. So emergency shelter can ask the client at entry, if we don't get a chance to meet with you, maybe the person just doesn't come back, so you don't get a chance to do an exit interview, they can ask them at entry, where is the most likely place that you would go if you don't come back here for us to do an exit interview? And the person can provide that answer. They can say, well, I'll probably end up at my brother's house or my family's house, or I'll end up in my car or back on the street, whatever it might be. So at the very least, the emergency shelter has an exit destination that's somewhat substantive. It's not a perfect way to solve the problem, but all that HUD asked about, what are we at, 6 years ago or so now? What HUD asked was for communities to come up with a plan to try to improve the data collection at exit for where a person may have gone when they leave the program. So that's one option. Your community can come up with their own, but the key is to try to come up with a way to have as much substantive information at exit as you can, and exit destination being one of those more important ones. Okay. Exit destination for PSH or RH, obviously you don't want people going to a negative exit. You don't want them going back into homelessness, emergency shelter being one of those, street, place not meant for habitation. You want that to happen as little as possible. The agency will definitely want to evaluate exit destinations off of their APR, because you certainly wouldn't want to submit an APR to HUD with that particular scenario. The household should know well in advance, hopefully, for rapid rehousing and permanent supportive housing, that you've had plans in place of when you're going to disconnect services, or you've had plans in place of when the person is going to occupy their own unit. So hopefully there's no surprises, but there are obviously circumstances where the head of household disappears, or you can't locate them for rapid housing scenarios, or they disconnect from services and they don't want to interact with you. But again, those should be few and far between. For the instances where outcome is not favorable, it's an opportunity for the agency to evaluate the interventions that were provided to that household. So you're going to want to look at those, and it's not to say that that's not already happening, but have some regular conversation using your agency's APR and looking at exit destinations and seeing how many people exited to a less than favorable scenario based on where they came from, and maybe look into the types of interventions that went into working with that individual or family, and maybe hopefully that will result in better outcomes for the next household that might have similar challenges that household before them may have had. Other than the APR, the exit data is evaluated on SPM and LSA. LSA will aggregate the exit destination as well as evaluate the locations. SPM evaluates this for PSH and RH. Difference with SPM being it's a metric 2. It's looking to see who's cycling back to homelessness. So it's going to look at people who exited rapid rehousing or PSH, and then it looks for anybody over the last 2 years who exited your PSH program or RH program and then ended up back in the system in an emergency shelter street outreach enrollment. So you may have exited the person to a positive outcome, but there's oftentimes, not often is probably not, that's probably too strong. There are scenarios where the person had a favorable exit from PSH. It's even recorded that way in HMIS. And then a year later, something happened where they lost the apartment and they ended up back in an emergency shelter. The system performance measure report is going to pick that up. And that's going to bring us back to an earlier conversation we had in a few minutes. So the tables below are the exit destinations from the APR. Note the section headings. So permanent, the temporary destinations, or the homeless destinations. Those are the areas you want to look at when you're looking at these tables. If you expect all your clients to show in the permanent destinations category, then you would expect to see zeros in the other two categories. And of course, as infrequently as possible, having people exiting with no exit interview or data not collected. The LSA tables, as we talked about, they're aggregates of where the people ended up for the community and how many of them exited, how many of them were served in an ES, SH, or TH setting or RH setting and then exited to permanent. So again, the LSA will keep track of that data for your community. Okay, so the primary goal obviously is maintaining housing. SPM and LSA evaluations of returns to homelessness. This is meaningful, obviously, because it'll capture clients who may have had favorable exits, but then somewhere in the last 2 years ended up back in street outreach or emergency shelter. So that's what this report is going to do. Your SPM report is going to look at this. LSA is going to look at it. So of those clients, the measure report, how many of them returned to a homeless setting within that 2-year period. So you can really only truly measure the returns for homeless for households who were re-enrolled, because obviously if a person doesn't re-enroll in HMIS, you really have no idea unless you're keeping track of them. If you continue interventions with households for a period of time after exit, if the person just never, if they lose the apartment but never re-enter into HMIS, obviously you're not going to know about those households, but you will know about the ones that do get a new enrollment in HMIS when their prior residence, based on the report, was a housed setting. So some of you are probably realizing that we're back where we started, because now we're back at that conversation. And this is where returns to homelessness is that 360-degree evaluation, brings you right back to the beginning. So now here we are. You had a client who had a favorable exit from a PSH or RRH program, and then sometime within 2 years of leaving that program, they ended up back in emergency shelter or street outreach. And now you're that street outreach person or emergency shelter staff person interviewing that client, and that client tells you that their prior residence was a permanent setting for a formerly homeless or a rapid rehousing setting with a voucher or a VASH setting or Section 8. You can now see where the power of the emergency shelter staff person and street outreach staff person have the ability to do an immediate intervention to try to figure out what program was that person in. Can you reconnect with case management and get that person back in their apartment and avoid a returns to shelter or returns to homelessness event in HMIS, but more importantly for that particular household. So this is where, again, that conversation with the client becomes vital, and as it's just important for it to not be robotic. And that is not a knock on street outreach staff or emergency shelter staff in the least. Emergency shelter and street outreach data entry staff and staff who work with that population or those populations have the heaviest lift throughout the entire system. The emergency shelter staff are dealing with new clients almost every day. Street outreach people are trying to maintain communication with a very challenging population and also establish new communication and contacts with a very challenging population. So they have ES and SO and street outreach have among the hardest jobs when it comes to the homeless population, and then add on top of that the data entry process. So when I say that notion of trying not to be robotic, again, it is important to get the data in, but it's also important to have those alarm bells go off when certain responses are collected. So if you're sitting across from the client, your street outreach and ES, the client says their prior residence was one of those housed environments. That's where you want to stop and say, okay, well, let's evaluate this and see if we need to bring somebody else into this conversation to get you back into housing. It's not going to happen often. I'm not saying this is something that happens 50% of the time, but it is important to recognize when it happens, because it does come back around to the HUD reports, and HUD is going to measure your community on its ability to keep people in housed environments and to keep people from returning to homelessness. All right. So where it's important is to have this conversation with the straight outreach staff and emergency shelter staff, so they know when they hear or when they're doing these data entries in these assessments, or they're collecting this data on a paper intake, maybe have it highlighted in red or evaluated, or have some conversations with them. Should they have somebody say that this was a prior residence, what's the next step for that person? Metric 2A will evaluate those who exit homelessness and move to a permanent housing destination. It's dependent upon exit destination that we talked about. And if it's to a permanent setting and the client re-enters, it will get captured on this table. If it's a street outreach to street outreach, or ES to street outreach, or street outreach to ES, or TH, so on and so forth, all that will get calculated here as well. But the big one being is how often somebody goes from a house setting back into HMIS into a homeless setting. Returns to homeless also calculated on the LSA tables. So it evaluates returns to homelessness on two tables. The first one will evaluate returns to homeless over the 6-month to 2-year period, give a percentage of that who exited permanent, temp, or other, and then returned to homelessness. And this will also look at first-time homeless and re-engaged and returning to homelessness and continuous homelessness as well. So again, being mindful of these assessment questions will help overall performance data, and hopefully help reduce the number of data entry responses that maybe were a mistake because of how the individual understood the question and explained the question, and also help to provide an intervention if there's a preventable homeless episode. So those are all your high impacts. The next couple of slides, we're going to just go through and then we'll be done. So know your thresholds. Each agency should have a grasp of their thresholds or benchmarks for success. How many chronic beds do you have? What's your occupancy or capacity requirement? How many positive exits have you had? How many positive income increases have you had? You're going to want to track those. Each agency should know their performance, how their performance rather will impact the community's data, and that's everything we talked about today. Each agency should be able to determine the health of their data and anticipate where they may fall short. So when you look at an APR now, you should be able to have a good idea of how your data is going to be judged, to use maybe too strong of a term, but nonetheless, how it's going to be looked at when it comes to when you submit to HUD, and how your data is going to impact the overall SPM categories and LSA categories that we talked about with the high impact assessments. And the last thing that it will also help you do is identify those opportunities. So again, those households where you have clients who disconnect from services and end up back in homelessness, or identify opportunities to working with people to improve income, or maintaining contact with people post-exit to help with better income, or better outcome rather. And then also looking at those outcome scenarios where you have positive outcomes. What were the nature of those households? What kind of interventions were provided that allowed for those positive outcomes? Things like that. So try to use it to better understand and identify success, because that's the other key. This isn't all about where agencies and users are falling short. It's really about where are they succeeding in their interventions with the households that they're serving, because the bulk percentage of your data is positive data. It's just those smaller percentages that have the impact on the performance measures, where if you can tighten up just a little bit, that little bit of tightening will go a long way to improving performance, and also having users, your end users, and those people collecting data have as strong of understanding of the nature of the questions they're asking and the intended data collection for those data elements. All that will go a long way in having downstream effects in improving data completeness and data quality. how to get started, agency level, regular review of your APRs or CAPRs, regular review of shelter data. At the community level, COC level, regular SPM review. You can run an SPM whenever you want at a caseworthy. LSA is not as easy to do. That's more of a one-year thing, but you can still monitor it on an annual basis. And PIT, obviously, PIT, you want to maintain your housing inventory throughout the year, so you can keep track of the changes in beds, and that'll also help agencies keep track of utilization. And you might need to assign committees for these tasks at the agency level and the COC level.
Hey,
There's,
Jim, this is
yep.
Sherry. I
Yep,
just
go ahead.
wanted, if you could pop back to that previous slide real quick.
Yep.
I just wanted to let folks know that Rita and I and Hanid have been in discussion about those items that Jim has listed for the community level. Rita's been working on committees and the requirements that they have, and they kind of overlap with some of the things that we would like to do. So please know that we've got that in progress, and we'll follow up as we move forward. Thanks.
Yep. The last slide is a slide for those of you who want to get a little bit deeper knowledge of the data as far as what the LSA table shells look like. Here's a link here. SPM, the program specs, there's a link here. There's also a link to the 2022 data standards. HUD provides some brief definitions for each question that gets asked in HMIS. So you can certainly take some time if you'd like to look at those, or you may just want to target a few, like what we talked about today, the questions about approximate homeless state started. Getting an idea of the language behind that question from HUD will help in the data collection conversation with the household. So I've provided those links as well.